Hello students, we will discuss again very common condition, especially in smoker. See this, what this condition is. Look at that limb, you can see that, you can see hairs here, normal girth, foot, nails. Here you can see the difference, nail is brighter, there is shyness of the skin, there is fullness in the wasting is there, you can see that. Now look at this. This is the wasting. See the girth here. See the girth of the limb. Here you will compare this one right to the left. This is the left side. This is the right. Right side. See that there is a wasting here. You can see that. You can compare this one. This one. There is wasting, loss of hair, thinness of the skin, brittle nail. All those typical features of the ischemia is very clear. Left and right. Right side there is a ischemia feature. Left side is relatively normal. So you can compare that. So typical features of ischemia are there in the left side. So peripheral arterial disease with the ischemic features of left leg. Wasting, can see loss of hair, brittle nail, reduced girth of the limb. Absence pulse, if you palpate, always palpate pulse from the distal to proximal. Make a chart, dorsalis pedis, posterior tibial, anterior tibial, popliteal, femoral, radial, ulnar, brachial, axillary, subclavian, common carotid or carotid it's called as, and superficial temporal, right, left, present, absent. Make a chart always when you write a case sheet of the exams, and the peripheral arteries is very, very crucial from below upward, not from above downward. And absence of pulse for exams very, very crucial to decide where is the level of the block. Now this is the young patient, look at that young patient. So most B class is TAO, thromboangiopathy occurs mostly in the smoker, mostly in the males, common in the lower limb, eventually may occur in the upper limb. One side, then later this other side. Smoking causing all those problems. Burgess disease, otherwise called BUREGER'. Burgess disease, BUERGER'. So I double is that. Angiitis, THROMBOANGITIS. This point to remember. It's the inflammation, hyperplasia, blockage, segmental, skip lesions. It may be eventually compensated or all those things. We would remember that TAO is a very common main question asked, and clinically they will keep as a short, long case. Then spotter, they can, so many questions, theory also they will ask. So remember about critical limb ischemia, definition, functional limb ischemia, Boyd's grading of intermittent claudication, rest pain, pre-gangrene, gangrene, Lerike syndrome in the aortoiliac block with the impotency because of the internal iliac artery blockage, and ABPA, ankle brachial pressure index, all these things to read about is very, very important, very relevant for critical limb ischemia, Boyd's grading, everything. And so for that, read my clinical methods in surgery. Arterial is everything detailed, my manual details properly, everything steps with the operative surgery details about the procedure of different peripheral disease with the vascular anastomosis, saphenous vein graft, that everything, and grafting, arterial graft, all those things. Then my beginner lectures through JP publishers, used to detail lectures of all these things, covering everything for UG and basic for the PG. So students, basic thing about the peripheral arterial disease with the ischemic limb, they have understood very well. Thank you very much.